Universe Phil podcast and happy holidays. I'm Katie Meyer, Senior Director of Content Creation here at APHA, and I'll be your host for today's episode. With HIV and AIDS Awareness Month upon us, it's essential to highlight the critical role that pharmacists play in improving outcomes for people living with HIV. From ensuring patients have the right access to the right antiretroviral therapy to providing ongoing support and counseling, pharmacists are key players in HIV care. Your dedication makes a significant difference in the lives of those affected by HIV, so thank you for all that you do. In part one, we discussed the latest updates to HIV treatment guidelines, which included several updates related to pharmacotherapy management, reiterating the pharmacist's role in optimizing care for people living with HIV. Today, I'm excited to be joined by Kevin Astle, a clinical pharmacist specialist with extensive experience in HIV care. Welcome, Kevin. Why don't you tell listeners a little bit about your roles and responsibilities as a clinical pharmacist specialist?
Yeah, thank you so much for having me. So, as a clinical pharmacist specialist, I'm involved in the treatment and prevention of HIV in multiple different practice settings with a focus on adult and adolescent care. In my role, I'm able to kind of help operate under two different hats I see. So, one is doing direct patient care for patients primarily with HIV prevention. They'll get added to my schedule, and I'm able to help manage their regimen and help make sure that they're taking their medications as prescribed. And then also as a consult service. So, if we do have any difficult patients or any history of resistance and any concerns, the providers can use me as a consult and help develop the most appropriate regimen. And sometimes that does involve going to see the patients right alongside those providers.
Awesome, Kevin. Thanks so much for sharing kind of a little bit about the good work that you're doing every day. So, as we discussed last week, there were several new updates to the recent guidelines that were just published, focusing on optimizing antiretroviral therapy for people who have achieved viral suppression, and then some also key considerations in managing age related comorbidities as the population continues to age. I'm sure that managing complex cases on the day to day can be very challenging, but also rewarding. So, Kevin, could you share maybe a particularly difficult case that you've had that you can reflect upon involving a patient with viral suppression and maybe an age related consideration and how you approached it?
Yeah, so that's kind of been an exciting part in our progression in HIV treatment is having this aging population and now bringing in comorbid condition management. I'm trained classically as an AmCare pharmacist, so I'm happy to bring that chronic disease state management perspective to HIV treatment. Particularly complicated aspect I've had relatively recently was a patient who not only is living with HIV but has diabetes, dyslipidemia, is at high risk for cardiovascular disease, and so really trying to understand some of their behaviors. So this patient in particular was not taking any of their medications really at all, and so trying to understand what their goals of treatment were and what their understanding of their conditions was really essential. And so, first trying to get buy-in about the importance of managing their diabetes was a really big step, but then being able to translate that conversation over to their HIV management was really critical so then the patient could understand, what the long-term goals were, and that while yes we want to see the viral load come down and achieve that viral suppression, we're now looking at, can we prevent this chronic inflammation, can we really help manage these conditions that are going to help you live longer and help and having more data now for specifically with our lipids and the reprieve trial, now we're able to be a lot more confident in how we can recommend some of that preventative care.
Yeah, Kevin, that's a great example. When you think about HIV and the aging population, there's, the multiple different comorbidities that also have to be addressed as well. So, certainly great perspective. Thank you for sharing that with our listeners. All right, let's shift gears a little bit and talk about patient adherence. So, we know challenges like stigma, access to care can be significant barriers for people living with HIV. Can you share some strategies that you found that have worked well for you in helping patients maintain adherence to their antiretroviral regimens?
Yes, this has been a fun challenge for me recently. In the last year, I've been integrated into a young adult sexual health clinic doing HIV treatment and prevention. And so my patient population is primarily around the 20 to 23-year-old age range. And not the best at taking medications. So, this for a lot of these patients, it's their first time taking chronic medications and taking anything, outside of acute treatments. And so, really understanding that importance of adherence has been fun to learn how to help patients to grasp. And so, a strategy that I've used with them is to really emphasize pill boxes and alarms and some of our classic tools we use for adherence, but then also trying to demonstrate that, we really need optimal adherence, missing no more than really 2 to 3 doses a month, and then really that's on the higher end. But trying to help demonstrate to them. So I've worked with some of my students on rotations also to help develop some graphics to really show them, if you're taking your antiretroviral therapy every day, here's how your viral load can stay reduced. Here's how we can have that drug concentration steadily throughout that time. And when we have those missed doses, showing how it can creep down and highlighting what some of the consequences of that are. So I found that that has been pretty helpful with these patients. A lot of young adults, I feel, are much more visual than auditory learners. And so having different tools available to demonstrate that is certainly helpful.
Awesome. Thanks, Kevin. Yeah, it's funny, like we shifted gears from the older adult to the younger population, and they all kind of have their uniqueness in all of those different scenarios. So thanks for highlighting some of those. All right. So just one more question for you today, Kevin. So for pharmacists listening who maybe they just don't specialize in HIV care, I'm one of those. What are some practical tips that they can use to support people living with HIV, whether it be maybe in the community setting, hospital setting, regardless of the practice setting that they fall in?
I think some of the biggest ways that we can help any pharmacist provide care for our patients with HIV is really helping to advance our ability to remove that stigma. And our medications for HIV are just like any of our other medications now. Thankfully, we are seeing reduced barriers to those, whether that's through some of the copay assistance programs, through enhanced insurance coverage, where I see patients have a lot easier access to their medications than they had when I was a student or trainee. I really think it's important that we can just bring our traditional principles of medication adherence, healthy living, and preventative health counseling to our patients with HIV, and just realize that there's nothing different there compared to our other preventative health treatments that we have now. I think we're fortunate to be in a time where we have our antiretroviral therapy that is extremely effective, able to get sustained viral suppression within the first couple of months, and just very few side effects and adverse effects for our patients. So really helping to make sure that our patients can take medications that are working best for them.
Awesome, Kevin. Thanks so much for that perspective. Just thinking about HIV as another chronic condition is definitely an important thing to do as practitioners. It kind of puts it into perspective that we're not a way that we're not used to thinking in as previously. So, thank you so much for spending some time with me today to highlight kind of some best practices and the importance of pharmacy and support. Pharmacists and supporting people living with HIV. I'm going to just summarize a few major takeaways from our time here today. First, shame and stigma are significant barriers for people living with HIV, affecting their ability to seek treatment and care. Using things like adherence tools, having candid conversations with patients about the importance of adherence, and then also using graphics and images can be options to help improve adherence. Additionally, as pharmacists, it's critical that we communicate with patients without judgment and work to eliminate that stigma. So, this means being self aware and understanding that our interactions can have profound impact on patient outcomes. By breaking down these barriers, using traditional principles related to preventative health and management, and realizing that HIV care is really no different than any other comorbid condition, we help make treatment adherence more effective and enhance the overall care experience for people living with HIV. All right, folks. Well, that's all the time we have here for today. If you haven't listened to part one of this month's First Fill podcast yet, it was released 1 week ago. In that episode, APHA Executive Education Fellows and I reviewed the latest updates to HIV treatment guidelines. So definitely check that out. For some other notable education from APHA related to HIV, head over to our learning library to check out the webinar titled Ending the HIV Epidemic: Pharmacists' Expanding Role and Impact in our learning library, as well as our newly released this year HIV PEP and PrEP certificate training program. And last but not least, don't forget to head over to the learning library at learn.pharmacist.com to earn your CE for this month's podcast. We'd love to hear your feedback. Thanks so much and take care.